Hello again, Ryan Smith at Better Life Carolinas. This is closing out the sequence of videos that we've made about our approach to preventative screening, and the last disease state that I wanted to talk about is cancer. That might be the scariest one for a lot of us, but we have made big strides collectively in our ability to monitor, screen, and even treat cancer. We are pretty vigilant about making sure that patients maintain their recommended screening protocols. For example, colonoscopies, mammograms, pap smears, PSA screening. That's something that we are certainly keyed in on. We also have begun to utilize a different type of test that some people refer to as a liquid biopsy. Up until recently, we really haven't had a way to screen for a lot of different types of cancers. For example, certain lung cancers or pancreatic cancer. But a newer test is available now that allows us to assess for risk for over 50 different types of cancers just from a blood draw. And this is a test performed by a company called Grail. It's called the Grail-Galleri test. And the methodology for this test is fairly groundbreaking. They're looking for evidence of methylation, which is a chemical process, on free-floating DNA in the bloodstream that is unique to cancer cells. So we all have free-floating DNA. When cells break down, DNA gets released into our bloodstream. But if it's DNA from a cancer cell, it tends to have a unique methylation pattern that can be identified, and finding evidence of that can indicate the presence of an otherwise undisclosed cancer. This is by no means a perfect test. There really is no such thing as a perfect test, but this test does have issues with some false positivity. That means an individual might be told that they have cancer when in fact they do not, and that can lead to a lot of worry, a lot of anxiety, and it can lead to some unnecessary follow-up testing. So the question has to be, as an individual, what are you willing to do with the information that you might get from this test? If you are willing to act on it, and if your goal is to try to identify cancers at an early stage when they can be intervened upon, then this test might make sense for you. If you have the mindset that you would rather not know this information, then this might result in a different conversation that you have with your doctor. Having said all that, I think it warrants a conversation. So the bottom line with cancer screening, as with screening for any chronic disease, is that it requires an understanding of the goals that we have in mind. It requires an understanding of what you will be willing to do with the information that we get from this type of testing. And all that necessitates a very good relationship with your physician. This is a give and take. This is not something that we dictate to every individual. But understanding some of the nuances with screening for things like cancer can be very helpful when you have this type of conversation. So if this is something that's ever been on your mind, if you have a strong family history of cancer, let us know. This is something that we are happy to engage in with you, and we look forward to having those conversations. Thank you very much.